Good morning and welcome to the Board of Health July 26, 2023 meeting. I'll call that to order and roll call or not?
Doesn't have to when we come back.
Okay, great. So the first thing we're going to do is to go into executive session according to RCW 42.30.111I to discuss legal and counsel matters.
It's a pretty complicated.
Right, thank you, everyone. And we are reconvening the Board of Health meeting. We have concluded executive session. Now we are introductions of guests and staff. Mr. Arnott?
Okay, we do have one guest. Danielle, do you want to introduce yourself?
Yeah, hi, I'm Danielle Watkins. I'm with the Educational Service District 105. My title there is Student Assistant Professional 1. I'm their clinical supervisor for the treatment program that we have in our agency as well. So
Welcome.
That's all the guests that we
All
have.
right, thank you. Public comment, do we have anyone from public comment?
There were no public comments submitted. I don't know if Danielle, have any public comments?
yeah, I just would like to share kind of a little bit about what we do. So
Join us there while you do that.
right here. Yeah.
Yeah.
Thank you. Yeah, so I just would like to share kind of what we do at ESD 105. So I'm part of the student support services. And what we do is we go into schools and we offer services to students, whether that's mental health services, student assistance professional services, or treatment services like drug and alcohol services. One of the reasons I'm here today is I saw that there's going to be some talk later on in regards to prevention with youth. And so I wanted to hear what was going to be said and maybe offer any other supports that we could. I am part of the fentanyl prevention group that we have at ESD 105. And so it's a group of us that come together and we started doing community events to educate our parents in regards to fentanyl, what to look for, how to identify signs and symptoms of drug use. We do what's called hidden in plain sight. We set up a mock bedroom and we allow parents to come in and kind of look around and see if they can identify any products, any paraphernalia, anything that would relate to drug use. Kids are not allowed in to that function. So during our Healthy Youth, Healthy Families function, we also had daycare basically, or a room for kids that were young. So parents could come in and get that education. So our first event that we had, we gave out 62 Narcan kits. And we had about 150 people attend and get educated on hidden plain sight and how to identify an overdose, and also how to use a Narcan kit and the importance of those. And then our second event that we held down in the Lower Valley, we gave about 40 Narcan kits and probably a little over 60 plus people at that event. And we're continuing to start planning more events in the fall and throughout the year for families to continue to get that education. And one of the things we're really encouraging them to understand is that the importance of having Narcan in their house is not saying that their children are using, it's just saying that there's a possibility that they could come in contact with it. And we want them to be prepared and be able to, what's the word I'm looking for? Use the Narcan to help get those students or their kids or their family members into treatment or into the hospital so they can get treated in a healthier manner than just kind of letting them not. So that's one of the things we're doing. We also have coalitions that are funded by CPWI, Community Wellness Prevention Initiative. And they do a lot of community work as well around the Starts With One campaign. I don't know if you guys have heard of that. You probably have. We do National Drug Take Back Days. So we also like advertise families to bring back prescription medications or over-the-counter medications they're not using. Obviously, one, to help keep our environment safe and also to keep our youth and families safe. And then we do quite a bit of other community work around prevention of substance use and mental health.
Thank you and welcome here today. I'm going to actually go ahead and step back to the seating.
Thank you.
Just a question, but do you hear any feedback from the kids or their use or any success stories?
So like with the kids that we meet with, yeah, we've had lots of success stories with the youth that we meet with in schools. Myself, I've actually done the schoolwork and been in the school and worked with kids and got to see kids that were struggling, change their lives and graduate high school and move on and be successful today. So there are tons of success stories. And then obviously we do have our stories that they just don't make it that far, or later in life, they have to get treatment. So
That's wonderful.
yeah.
I'm going to interject something else at this point rather than the consent agenda. Commissioner McKinney, I understand you need to leave early today. And you had 2 items on the agenda. Would you like to address those items now, or would you like to table them until the next meeting?
Well, I think the agenda item that I had brought forward was specific, and thank you, Madam Chairman. This particular item was the topic of youth outreach and prevention. And so I would, unfortunately, I have a conflicting schedule, so I would ask that it be tabled, but certainly welcome comments on it and certainly any board conversation. But I would need to address it later, and I do apologize for the conflict in my schedule.
So we'd be happy to table it. I think we'd have a consensus about that. And we know that the executive session ran long, so understand your conflict of schedule.
Thank you, Madam Chairman.
Mr. Idle, we are at the consent agenda.
Okay,
With the reduction.
so the 2 consent agenda items are June 28th, 2023, Yakima Health District Board of Health meeting minutes. Payment of accounts payable and payroll issued in June 2023 in the amount of $939,580.
Both those items will be addressed in one motion unless anyone on the board would like to do that. Anybody like to do that? If not, I'll entertain a motion to approve the consent agenda as read.
Madam Chair, I move that we approve the consent agenda as read.
So we have a motion and a second to approve the consent agenda as read. All of those in favor, please say aye.
Aye.
Any opposed? Motion passes. Thank you very much. The next on the agenda is our spotlight, which is going to be Director of Public Health Partnerships.
Thank you. Yeah, so today's spotlight will be around what's called an after action report. So an after action report is something that's required through the incident management system. And for those of you that aren't aware, the incident management system is essentially what the incident command structure falls under. It's a national framework for different partners to be able to work together and speak the same language during emergency responses. So people that are working at the federal level, at the state level, community-based organizations, they're all working under the same framework to be able to work together in times of emergency response. So in the next slide, we'll see what the different what the goals of different after action reports are. For these different reports, ultimately the goal is to find opportunities for growth, make sure that we can recognize the areas that in which the response went well, and ultimately come up with recommendations for future preparation. And this after action report is required after any time an incident command structure is followed. But today we will be talking about the after action report related to the enormous response around COVID-19. So in the next slide, we'll see the timeline that we're looking at specifically will be around when the Yakima Health District's team was activated, which was March 2020 through October 2022. So that's a 2.5 year timeline that the emergency response team was activated through the Yakima Health District. I do want to take a quick moment to recognize that in most organizations that are larger, typically people cycle in and out of the response for every 6 weeks. But of course, given the sheer amount of work and the size of our organization, the people of the incident management team were responded and active during the entire 2.5 years. So thank you to all the entire team for that. Next slide. So in terms of collecting the actual feedback, because again, that's what this report is for, is to collect feedback from both the staff and our partners about what went well and opportunities for growth. This feedback was collected primarily through 2 different surveys. There was a staff survey and then also a survey that was delivered to what we call external community partners. The questions between the 2 surveys slightly differed, of course, because staff had different involvement than some of our community partners. And the satisfaction was leveled between 1 through 4, so 1 being very dissatisfied with 4 being satisfied. There were also opportunities for some open-ended responses in which I'll be sharing a couple of quotes based on those as well. Next slide. And here we'll just see again, as I mentioned, the differences between the 2 surveys, but overall looking at capacity and again, looking for patterns in terms of things that went well and things that could be improved upon. Next slide. A quick summary between the 2 types of surveys. There were 44 surveys sent out to staff and then 482 sent out to external community partners. Of course, as you can see here, we had a much higher response rate from our staff, almost 90%, and our external community partners responded at about 20%. This survey was also sent to all of you, to the Board of Health members, and your responses are collected as part of the external community partner response rate. So even though we had a low response rate from our partners, we did get quite a variety from different sectors. So it's a total of 13 different sectors represented. So we are comfortable with the diversity in terms of the types of response and types of community partners that responded. Though of course, we would have loved to have seen a higher response rate.
Can I ask a question?
Yes.
We don't, there's no category for like just individual citizen at large, right? Like, we didn't, just any community member?
Yeah, so the way that this was disseminated were people that we had actually worked with.
Worked
So
with,
it's typically, we did a collation of all the different outbreak response investigators, people that work with schools, people that we directly worked with throughout the. Next slide. So we'll start with our strengths. Next slide. By far the biggest consistent response received from our staff was just how supportive the leadership team was in this entire time. People within the staff mentioned that they felt supported throughout the entire response, both with their ability to feel supported in the training before taking on these new roles, as well as support and ensure from other staff members with their on-the-job training. Again, people felt that they were considered in terms of the personal protective equipment available to them, given their different roles. Of course, our staff were the first ones to staff the testing sites. So making sure that people were able to work from home right away when needed, and ensuring continuity of operations. It was very consistent and great to hear from the team how supported they felt throughout this entire time. Again, that they felt that work-life balance was promoted and that they received the tools needed to complete their work at that time. I will share a quote. That says, it was stressed to staff, and this is from one of our staff members. It was stressed to staff that if you need time for yourself to take that time and rest, we were always supported to take time away if needed to decompress, reflect, and rejuvenate. In fact, 68% of staff reported feeling very satisfied with how well the YHD leadership team supported them throughout this time. Next slide. Another strength recognized by both our staff and our community partners was the agency's ability to effectively collaborate at the state and federal level, at the local, state, and federal level, to ensure that we were able to receive resources within our community. So having this strong organizational support to actually receive these grants to disseminate the different supplies to the community was also recognized as a strength. And another strength mentioned again, both by the staff and community partners, was the agency's ability to ensure equity in terms of prioritizing different communities that were hardest impacted by the pandemic, and making sure that resources were prioritized there as well as to the rest of the community as needed. Another quote from a staff member: since the COVID-19 pandemic, I feel like providing equitable information and resources has become one of the agency's top priorities, not just around COVID, but around all program planning. Next slide. Another strength identified by both staff and partners was the agency's ability to engage with the community. So both staff and community partners recognize the sheer amount of information that was going out from this agency on a day-to-day basis. Of course, that was necessary given the changing guidelines, directives, and information and knowledge that was acquired. But a quote from a community partner was, family members and friends let me know that they appreciated updates about COVID through radio segments and interviews. Social media posts were clear and concise with helpful information and links to resources. Another positive aspect was the recognition that the Yakima Health District had to work across and build many different partnerships in order for the response to be effective. And a great measurement of that is that from our community partners, they were asked, what was your level of partnership with the Yakima Health
Harvey
District
Monkey.
prior to the COVID-19 pandemic? 42% said that they did not have a relationship with the Yakima Health District prior to the pandemic. And they were asked the same question, how's your relationship after the response? And right around 70% responded either a positive or very positive relationship with the Yakima Health District after the response itself. Next slide. And now for some opportunities for growth. It's again along the same veins in terms of, as you'll see, but just looking at things a little bit differently. So while earlier I mentioned that staff did feel very supported, there was a sense and feedback that there were missed opportunities prior to the emergency response where further training could have been provided to better prepare for an emergency setting. Though of course, there was a quote that said, I don't know how you could have prepared for this, but more training would have been helpful. Again, one thing that was very clear was that while there was a huge emphasis on external communications, as was recognized as a strength earlier, that the health district staff could have done a better job about improving internal communications, where there were missed opportunities to ensure that staff that weren't directly involved with the response were able to also keep up with the pace of information to better inform the public and better represent the agency. So that was a very clear opportunity for growth for the team moving forward. Next slide. In addition, another opportunity was the clarity of information and further engagement. Community members felt that there were insufficient testing sites and that there was more collaboration that could have been done in selecting the sites of the different vaccine sites when available. Again, community members were not always clear on the information or where to access the information. There was particular emphasis placed that when looking for testing sites and vaccine sites specifically, that the way the information was made available and the way to make the appointments was not conducive for those that weren't technologically savvy. Again, another point, both from staff and community members, were that they would have liked to see the different staff actually staffing the testing and vaccine sites also have more of an education focus, and they felt there was a feedback that these different mobile sites would have been more effective if there was a higher emphasis placed on education at the sites themselves rather than just health education via media and social media. So focusing more on the in-person education at these different resource sites as well. Next slide. And finally, of course, enhancing equity and transparency. So of course, as we keep referencing, just the sheer amount of information that was changing on a day-to-day basis was a point of growth and opportunity to examine how can we better inform people that information is changing. People said that it was difficult to keep up with website updates. It would have been more helpful to receive a newsletter to say, hey, we updated this on the website rather than having to seek it and find out once you actually got the information hadn't been updated. In addition, as mentioned earlier, just the continual progression and equity of YHD service delivery, meaning that community members think that there's more that could have been done to engage directly with community members to receive their feedback on fair equity for different resources and mobile sites specifically. Next slide. And so what I did do is summarize a very long report. I do want to recognize that that report was sent to all the Board of Health members. It's also available to the public on our website. I highly encourage everyone to read it. There's many more quotes from both staff and community members that I think are very helpful to keep in mind as we work towards the future. But next slide. The purpose of the report itself was, again, to identify the different strengths and opportunities of growth, which will eventually turn into an improvement plan. And so the improvement plan itself is a way to operationalize different feedback to make sure that we can implement it moving forward in preparation for the next response. Next slide. And again, as always, we want to make sure that everything's tying into our strategic goals. So of course, responding to the COVID-19 pandemic is essentially our mandated service. And as was mentioned as a strength, we had to develop these different partnerships in order to do so. And finally, the whole purpose of the report is essentially quality improvement, which is increasing the effectiveness and efficiency of the district services. Thank you. Any questions?
I don't have a question, but I would like to comment that the translation that was done throughout COVID was great. It was done really well.
Thank you. Any other comments or questions?
Commissioner McKinney is right here.
Commissioner McKinney, go ahead, please.
Thank you, Madam Chairperson. I would just like to say that while I think this is hyper focused on the staff, I think that what Commissioner Curtis actually just alluded to in his question is that this doesn't involve the perception from the community. And I would say that I'm not supportive of this being the final stamp of approval. If in any way it is an endorsement of how COVID was handled by public health. I think it was egregious to present it in a manner where those folks who were taking time to discern whether or not they wanted to get vaccinated were allowed to be treated differently, harmed, losing their jobs, having people treat them as though they were disgusting individuals. I think that we could have done a much better job of approaching it from the standpoint of this is something that you can choose to get educated on and you can choose for yourself. But I think that it was very condemnatory towards folks who wanted to take time to decide. And if they ultimately chose not to get vaccinated, not to mask, those people who decided that they did not want to live their lives according to those who were the most risk adverse. So I just want to make sure that from my point of view, the handling from a public health standpoint with regard to actually listening to the voices of the people and what they did and didn't want public health telling them to do and invading their lives was a huge miss. And I hope we do not repeat those same mistakes, especially when it comes to our children and how we kept them out of the schools and those systems that are set up to protect them from home violence and things of that nature.
Thank you. Are there any other comments or questions?
Yeah,
Commissioner
I
Liddy.
might add a comment. Yeah, I think at first, you know, there's kind of two elements here. One is the local approach. And I think as far as the Yakima Health District, we had a lot of engaged committed staff. I think that the communication and cooperation that we saw between agencies and was a very positive thing. I'm gonna piggyback a little bit on what Commissioner McKinney said, though, that I hope also that this pandemic is a learning opportunity for us. And obviously, I mean, I look around the room and nobody was here at the last pandemic. I know that, you know, 100 years ago. But in hindsight, I think we've got to be really cautious as we make broad decisions on, you know, summary decisions on the behalf of the people. And yes, there were certainly people that were more at risk than others, but the harm that we caused, you know, to businesses, obviously there's a lot of things. I don't want to, you know, miss the fact that COVID was real. I was in those hospital rooms with patients at times, and obviously it was, I don't want to dismiss that side of it. We do want to take steps to protect those people, but we did see harm done to businesses, certainly to our students who are, I don't think we've still figured out how to get them caught up yet. And I think we've also learned, I think if we've learned one thing from a pandemic is that people need each other. You know, we saw a lot of mental and emotional harm done by people that were isolated and separated. And so I hope as we move forward, hopefully we don't have to deal with this anytime soon again. But if we do, I hope we can really think carefully about how steps and emergency measures are, you know, and the length of them. We have to take all that into focus and really look at the overall good for everyone. And that's all.
Thank you. Any other comments or questions? Dr. Bard?
Just like to add that for many of the things that were done, like the lockdowns and stuff, there's a lot of intensive study going on now and probably publication in the near future, determining how little could have been done and had the same effect. So there's a lot of study of the value of what was done with vaccines, with lockdowns, with social isolation, with PPE. So I think we'll have a lot better approach when another pandemic comes around, because the intensity of evaluation that's going on at levels like CDC and other government agencies.
Thank you. Any other? I'd like to say, Commissioner Lindy, that I agree with you. I think that if nothing else, we've learned a lot about individuality and local community needs in this as well as overall. And I hope that if anything like this happens in the future, that there certainly is more consideration of that in terms of, you know, locally and community what we need. I know that a lot of things are being evaluated now, Dr. Barg, and I've listened to just parts of those things. There are some things I think that were valid, other things I think they're saying, wow, they really weren't as valid as we thought they were. They weren't as effective as we thought they were. And it caused a lot of division and damage within communities as a whole. And, you know, it's been mentioned to our children and our businesses. So I think in the long run, there are lessons to be learned, but I do want to say, having, you know, been mayor at the time and working through this as a partner in the community, I do appreciate the collaborative spirit and effort of this community in many ways. So any other thoughts?
I guess I would just add that I think that we as a community and a larger community at whole should really work toward getting people whole for jobs that they lost or displacement of their income in relation to vaccination status. I think that those obviously, as time shows, those might have been positions taken that might not be taken in the same way today with the knowledge that we have today. And so anything that we can do to repair losses for people or to reestablish what it will look like going forward, I think we should do everything we can to help prevent that from happening again and maybe even rectify some that has already happened, because damages were suffered by people, lots of people, and I'm not certain that all of them are repairable, but nonetheless, we should do everything we can to try and rectify what I think was a gross injustice in many cases for many individuals.
Thank you. Any other? And honestly, I agree with that. And one of my greatest concerns, I know this probably isn't the health district, but for the community as a whole to consider is how we bring our children forward from this point. How we help them catch up in what they missed for a year and a half, 2 years in the educational process, including socialization and those critical things.
Yes, that's all. Thank you. And so, as I mentioned, the after action report is a part of all the emergency responses. So I'm sure we'll be providing updates on some of the others that we're in the process of doing as well. So thank you.
Thank you, Lillian, very much. We're moving forward into agency reports, and we will start with the executive director.
Thank you so much. I wanted to share that I'm going to be brief because we do have a spotlight and we also have an executive session. One of the things that we're in a good position on is our financial position. Not only are we continuing our grants that we've had in the past, many of those grants have increased, and so you'll hear that, but we also had circumstances where we increased even what was the potential for investment in local communities, and that's through what's called the Foundational Public Health Services investment, or what we refer to as that. So that had started over the last few years. It was incremental. It increased really a great deal over the last 2 years, and it's also increased this year as well. So if I'm not mistaken, our full investment from the state legislature for Foundational Public Health Services was $2.5 million. And now it will be additional $1.1 million. So we're at $3.8 million, or 3.6 million for this fiscal year. We'll receive that in two allotments. The first one we received for 1.8, I believe. Am I right, James? Yeah. James will go into more detail. I wanted to share this with you because we'll begin our process, and you'll be hearing from Ryan about how we anticipate next year's budget. And we start that process early, so we have those discussions in August, and it comes to the board as initial discussions in September. But I share with you candidly that one of the things we were attempting to do when COVID began was to prepare for where we would be fiscally and in terms of support for staff coming out of COVID. And I think we've done exceptionally well. We've been able to retain staff, we've been able to train staff, and we had an eye towards hiring folks during COVID who could then be retained after COVID. And we've also done quite well with that. We've had people who are very interested in being part of the public health mission and serving their communities. They're local folks, and they're excited to be here. So we're really pleased. I do also want to share with you that we asked a lot of our staff, and they committed a great deal to keeping our communities protected, following the law, and also supporting local businesses. So the outreach that we did in an essential workforce community, as we had a central business community, is critical. The ability for the staff to be prepared to move nimbly, to pivot towards the needs of certain communities as we noticed there were certain hotspots, and to support businesses where they attempted is something that we took very seriously. So that commitment is something that I'll always be grateful for, and I just want to share with you as the board that the majority of our staff were here for COVID. Many came in during COVID, but they've been retained, and they feel really proud of their commitment. So that's all I have to share, unless you have questions.
I'm hearing no questions in. Ms. Nyland.
Okay, human resource side of things, we do have a couple open positions that we'll be advertising shortly. We have a public health technician position and then also we're gonna coordinate position. So we advertise those pretty good. We have had a couple of internal promotions, which have also been created when they get promoted and vacant positions, which that we will be advertising for also. And so probably next month, we'll have about 3 new employees that will, either 3 new employees or employees that have been promoted that we'll be bringing in, to introduce to everyone. Also on the after action report, as Lillian mentioned on that last slide, that there is an improvement, an improvement plan. And we're looking at that. We want to make sure that we don't just have this, we act on it, and so that improvement plan will be finalized soon, and then we'll start making sure those things are put in place. And then finally, as Andre mentioned, the budget will start, process will start in August. And so the first thing we'll do is at next month's meeting, we'll be seeing the fee schedule for 2024 to the board. We don't expect any changes. We'll have a month to review it. We'll have a public hearing in September, and then it will be fees. Also, in September, we'll be introducing the budget to the board. Again, you'll have a month to review it, and then in October is the expectation that it'll go in front of the board for a vote for approval. And if for some reason that doesn't get approved, then we'll have the December meeting also that can be approved. So once we get through this meeting, get finished with an audit that Jake will talk about, then we'll, next thing is budget.
Any questions or comments from Tyler?
But Councilwoman, I'm sorry, Commissioner McKinney had popped off the meeting.
Thank you very much. For the record, yes, we see that. All right, thank you. Any questions or comments? If not, then we will go to the board.
Good morning. Talk a little bit about the audit that we're going through right now. There's actually 3 audits that we're gonna have to experience this year. We're actually in the middle of 2 of them right now, the financial and the federal audit, which is due at the end of September for state law. So we're in a good spot to wrap up that audit by the end of September. Hopefully in the next couple of weeks, that'll be getting wrapped up. But then again, after the September one finishes up, they'll be back in October to do what they call an accountability audit. They'll start auditing workforce grants. So it's going to be one of those long audit years for us. State Auditor's Office, SAO, had a lot of COVID federal audits to do this year. Generally, we try to do them all at once, get them in the door, have them do all their activities, all their testing, and then get them out the door. So they're going to be it's kind of a little bit of a revolving door this year. And a lot of it has to do with a lot of state agencies having very high federal funding due to COVID. So we're going to get to the other side of the COVID funding, and I am for one excited about that, and so is the state auditors. Which they've expressed that to me. I think we're all excited to kind of get on the other side of this. And as Ryan alluded to, we're going to start our budgeting process. We do start budgeting. We're going to start talking about it this week. It does start early for the health district, so that we can get it wrapped up hopefully by the end of October when we meet in October. So that we're good to go for the next year. One of the challenges that we have for 2024 is our FTEs. Right now, we've been high 40s FTEs. Once you hit that 50 FTE mark, additional reporting comes in and additional taxes come in. So this agency is really growing. We've never even flirted with the 50 FTE mark. And here we are looking at going over that for 2024. So we're planning up for that and talking about that now. Any questions about those items? Moving into the financial report, which starts on page 9. Again, I'll talk a little bit about FPHS when we look at the income statement. For the month of June, we had a $367,000 gain in excess revenue to bring it the mid-year at $1.3 million. For our revenue, our allocated budget was 4.9. And our actuals coming in at closer to 6 million. And our expenditures, the allocated budget through June was 5 million. And our total actuals are coming closer to 4.7 million. Any questions? Okay, moving into the next page. Foundational Public Health is one of, if you're looking at the year to date, we spent $1.2 million of that in the first 6 months. As Andre expressed earlier, Foundational Public Health is really, FPHS funding is going to be our future funding going forward for some time. That funding has allowed us to become current with much of our technology. A lot of our technology was old, but now here we are with our screens, our computers, and our online and our live and our cameras. So we've been able to catch up with that, and with updates in the buildings and with our just our equipment for our employees. But now we're starting to look forward. We're starting to, now that we've supported our staff, we have a lot of staff support, and we are growing our staff, but also engaging the community. With this funding, we were able to buy Narcan vending machine, gun lock safe. So we are looking to engage the community with this funding, and that's what we're going to be doing this next couple of years with that. A couple highlights is developmental disabilities. We've had additional funding with that we were able to help support our local providers, which was a great boon for everybody. And then surprise to me is the investment income. We have $647,000 in investment income coming in this year, which is quite a surprise. So it's nice to see that, and that has everything to do with just the economy in general. So it's nice to see that turning around. And then lower down the page, of provider services for DD is one of the larger expenses. Again, now we're like the pass through, so more revenue, more expenses for that. Any questions on this page? First part of the income statement. The second part of the income statement, I would the largest variance that we're having right now is lab and pharmacy supplies, and that has to do with our large Narcan purchase that we just made that we're looking to provide the community with. Any questions on the income statement? All right, moving into the programs. Again, this clay section area here is FPHS funding. So there's a wide variety of that we've been able to engage internally and in the community with FPHS funding. Nothing really major to point out here at this point in time. Is there any questions? Next page. Again, there's nothing, we have some quarterly billing and some seasonal billing that's causing some fluctuations and variances, but those come together as any questions on this page? Okay, next page is COVID funding. Not much to note here. Is there any specific questions for COVID? Okay, last page is our cash flow for the year. At the midway point of this year, we have roughly $12 million in cash and cash equivalents. I do expect to see an uptick maybe this month. We haven't received our foundational public health money, which is $500,000 total, so $500,000 in January, half in July. Sometimes that comes on July 31, sometimes so post in August, sometimes. So I do expect an uptick, but that uptick might not come until August, kind of depending on how that money falls, but that gets receipted in 31st or the 5th. Now, if there's any questions, that wraps up my report.
Thank you.
Chase, I don't know if you're the best person to answer this or not, but you're talking about the growth of the staff and the FTE. I just wonder if we could, and maybe it's something that can be done in a future health program, just kind of looking at pre-COVID to where we are today, pre-foundation of public health funding. Where's the growth? What are the new services? What's the new assistance that we have? I know we've gone by it piece by piece, but I'm just kind of wondering if we can get a general snapshot of that.
Yeah, I want to say we'll certainly dig into this a little bit more, but just off the top of my head, when I started here in 2017, beginning of 2017, we had about 32 FTEs. I think around budget about 36 is what I'm thinking, as I remember. So we're at, at least 10 more FTE, 15 more. A lot of it is we have new FTEs for communication. We didn't have a communication. Social media having a presence on social media wasn't a priority. That certainly changed that aspect of that. And that's kind of those things, and a lot of it is internal support for communications, for we're being asked to do more. Our breast cancer health program has expanded quite a bit. We're managing Eastern Washington, used to be just the Yakima County, and now we've received Spokane, and the revenues for that. I want to say was like 600,000 when I first started, and now it's $1 million that we have for BCHD. DD's grown as well the past few years, and so there's been growth in different areas and different factors, and a lot of it has to do with additional funding. We're able to more or less become current. We're able to, as a communication specialist, add some manager roles that we're adding now. That's able to help support executives and also staff, so that we can get engaged in the community.
So you can see he's not just a finance director, he's our public relations expert.
That was pretty good for a numbers guy.
So if I can add, we've taken a systems approach to strengthening this agency over many years. So part of that was working on efficiency and working on cross-training pre-COVID. But we've also made investments in the areas that create infrastructure so that we can be more effective in supporting. And part of that, again, is this catalyst model where we need to have staff who are engaged, not only with the community, with community partners, but also working with the state so that we can bring more resources to that. So I think it would be helpful to have a spotlight focused on that. There was a tendency in previous years in public health to say, if you have more staff in, let's say, environmental health or nursing, you will impact change. But the reality is that to do the same job the same way may not get you the same result. So what we're attempting to do again is to focus on ways that we can be more strategic in our investments, strengthen our ability to retain staff, and also to create staff opportunity. There was a tendency, I think, in government for many years to say that you hire somebody and they're in the same job, doing the same thing for many years. We're actually attempting to broaden the awareness of our staff so that they understand how the pieces fit together. You'd be surprised at such a small agency, but when I first came here over 10 years ago, there were some staff who were unaware of what other departments did. So they couldn't understand the impact of the different work that we were doing collectively. And I think of this as a small health department, it's considered medium, but there really wasn't a lot of internal communication. We worked very hard to change that so that our staff understand that their work in their department impacts the entire agency's focus, and that in turn impacts the entire community's strengths. So that's part of it. So we can communicate that, and I suggest we do that as a spotlight.
Yeah, I like that.
Yeah, we've also focusing on the front desk. When I first started here, we would close for lunch. We closed from 12:30 to 1:30 every day. And so that would create a backup and angry customers. And so we have that open all day now. And so that's definitely a change that was very helpful. Closing that down for COVID and then opening it back up was a big challenge as well. So it's definitely been a lot of change.
And I'd also like to give compliments to our directors, but also Ryan is specifically working with James. We had 3 unions at the time. So in order to make a lot of these changes, we had to work not only with the unions, but to align our strategic purpose with the goals of the union, which were very ironclad and were not really flexible. So we wanted to strengthen things. Something as simple as changing our front desk practices could not be done in a drop of a hat. So we had to have more staff to do it, but we also had to explain why we were open and communicate that. But that's a bottom line change that's really exciting for me. Actually small change, but really important for people coming to get services here, but that's one of many that we can illustrate to you.
Yeah, we bought a new motorhome. Yeah, you got a new fleet of rigs. Yeah, there's a lot of updates, yeah.
We'll look forward to that. That future focus. Thank you.
Just really quick, I like where the conversation is going, but I also think it's important for us when we have this discussion to know where the funding comes from too. I mean, I think it goes without saying that a lot of the funding that flows into this district doesn't come from Yakima County. We're very dependent on federal dollars, state dollars, and other specific programming. So those can be turned off in a whim. And so that, for me, that's an important thing to always keep into consideration as an organization continues to grow and grow and grow. Is it going to be sustainable if X happens? So, yeah.
Well, I want to thank you for that, Commissioner. I wanted to share with you that we have always taken the stance that if we were to grow staffing, we could not do it from our bank revenue. That's not a long-term strategy. We had to have revenue sources that were pretty concrete. And so I should take the time to communicate that to the board more about the strategy that we use. The faucet of funding was essentially dry when it came to rural Eastern Washington. And so we've worked very hard to be a strategic partner and a valued partner in Yakima County. One of the reasons we work so hard on innovation is that's where funding comes from, is being a first year and then having the commitment long term. And we spend a great deal of time and we can share that with you as well. So I'm grateful to say that. The key for us always when we talk about funding is this sustainable funding? Is it long-term funding? Is it something that we're going to back down? We do not want to hire staff around that, and we do not want to create initiatives that we can't make good on. We've got a good track record of that, but I'm grateful you bring it up because in fairness, I'm not certain that I have thought of it that way. I'm not sure that I've thought of, and we can work with our directors on how many initiatives we've created that have sustained with stable funding and increased funding. I think of things like the developmental disabilities program and the professional health program. We've strengthened those programs, and that was a direct relationship with funders, but happy to do so. We also, I want to share with you candidly, we attempt to spend federal dollars and state dollars first before we spend local dollars because we are not an affluent community. So we are trying very hard to find a balance. But we also want the community's needs to be heard at the local level and then communicate up to the state level. Thank you.
Any other questions or comments? If not, then we'll go to Dr. Neil Ward.
Two things to talk about today. One is an increase in multiple antibiotic resistant Shigella worldwide. And it's been an ongoing study that's dated back in 2022. Melissa's going to talk about what's going on locally in regard to Shigella infection. Many of you might not know Shigella is a gram-negative bacteria that causes severe diarrhea, fevers, and what's generally called dysentery. Most of these cases are self-limited. They last from 5 to 7 days. But a very little numbers of organisms are needed to cause infection, between 10 and 100 organisms, which means it's very easy to transmit it from a person who's infected to people. So some details on this strain: about 300 cases have been reported worldwide. 106 of those cases have been in the United States. And the other countries include Belgium, Denmark, Germany, Ireland, Netherlands, and Spain. The resistance pattern makes almost all the usual antibiotics that we would use to treat it ineffective. So there's about 7 antibiotics that normally could be used, and none of them will work in this particular strain. CDC has no recommendations about what to treat it with at the current time, but remember, most of these cases are self-limited. One of the best ways to deal with this is to prevent it. And people have to understand how you get it. So it's from contaminated food or water or exposure to human feces of a patient who's infected. So there's a lot of measures, sanitation and hygiene measures that can be used to prevent the spread. One of the more interesting outbreaks occurred in January 2023, and several countries in Europe and the United States, patients were infected. And they looked back to see where they had been, and they were traced back to a resort in Southern Africa, Cape Verde. And it only happened to people who stayed at 5-star hotels. So there's another reason to go to like budget in. So the symptoms should be recognized by people who are in close contact situations, for instance, food handlers. So if they're infected, they don't wash their hands well, they may transmit it to food, which then may be transmitted to other people. They shouldn't actually be at work, and they should go to their doctor, and a stool culture or a DNA test of stool can identify the presence or absence of the organism. And Melissa, like I said, will update you on what's going on locally. The second thing I want to talk about is just an interesting newspaper article that popped up. Oh, can we show the slide on that? This is for the last topic. It's this graph that will pop up. It's from CDC. So it's the number, the percent of organisms isolated Shigella that have shown the multi-drug resistance pattern. See, going back to 2015, there was 0, and then very, very low numbers until 2019 to 2022, and it's just gone through the roof. But what that says is that 5% of Shigella isolates in the study area are now multi-drug resistant and potentially non-treatable. And, you know, if any people who have underlying medical problems, immunocompromised, Shigella can cause a very severe disease, young and old as well. Okay, we can take that down. The second was there was an article in the New York Times about country fairs that have pigs on display. Scientists from Ohio State have gone around and sampled basically pig slop and sent it for analysis, and they found about 25% of pigs at country fairs carried influenza, swine influenza. The interesting thing about pigs is they can be infected with their own strains, the swine strains, but also avian strains and human strains. What happens in that situation is when all 3 types are stuck together in the same animal, there can be exchange of genetic material to create new strains. And nothing happens with a purpose, but randomly, one of these strains can turn out to be a easily spread strain, like happened in Mexico in 2009. There was a strain that emerged from swine that actually went all over the world. It was a pandemic, but the numbers were really low. So one of the points of this little section here is that the risk of us having pandemics is pretty high because population, bringing people together, and contact with animals. So it's not just wet markets in China. It could be state fairs where there's at-risk animals. The people who are working on this recognize this issue, and they talk with the fair organizers, and they put a lot of hand hygiene stations all around. And when they were surveying for use of the hand hygiene stations, they found it was very low. So there's some easy solutions to this, but we have to get people to understand that they should be used. So, and this, to just put it in perspective, so far, very few people have died from this. It probably is going to take a new strain to be created. Remember, swine flu caused the 1919 pandemic, and probably for some similar reasons. And just to compare it, 6.9 million people died from COVID, and that's worldwide. And another thing could happen in a similar state. I think we're in better shape and better prepared for it. So I'd be happy to entertain any questions.
Dr. Barr, are you seeing Shigella in cruise ships? You see those outbreaks that happen pretty frequently on cruise ships.
Most of the outbreaks that are going on cruise ships are from virus from norovirus. And again, it's a agent that's in gastrointestinal tract and requires good. The Shigella strains can be transferred through sex. So it's when these are going around, it becomes a sexually transmitted disease because of fecal oral contamination. So populations that are promiscuous, this current problem is occurring at a high proportion. So it includes people living with HIV, people who have sex with the same sex, international travelers, and homeless populations. So there's all those risk factors occur in many communities.
We don't have any cases in Yakima County.
We don't know yet. Melissa will talk more about that.
No cases of Shigella?
Drug resistance.
Oh.
We don't know. We're waiting for some information. That's okay.
Any questions or comments for Dr. Moore? If not, then
I'll follow up with the Shigella. Currently, we have 25 cases in Yakima County of Shigella year to date, compared to 2 year to date last year. So we have reached out to the State Department of Health and our partnership with them to alert them of our increased cases. They informed us that King County and Spokane County are also having an increase in cases. So they're currently diving further into the data and the case investigations that we've done to kind of look and see what the potential risk factors are for the cases locally and in King County and Spokane County. So we're looking forward to hearing from the Department of Health on that. The next thing I wanted to talk about was Vibrio. It's obviously summertime. Vibrio is another enteric or bacteria that causes nausea, vomiting, diarrhea. It's found in oysters. So we've had three cases that have affected us locally. We've had two residents in Yakima County. One that ate raw oysters at a local restaurant here in Yakima County. One that was at a event in Moses Lake, and the other one was harvested their own oysters. So we've had 3 Vibrio, which is not common for Yakima County. The last time I think we had a Vibrio was several years ago, so it's more common on the west side when people are harvesting oysters and it's more accessible. But it is common to find Vibrio in oysters. But that's why in restaurants, you just have to put on there, raw or undercooked seafood is a risk. But the more exposure you have to it, the more likely you are to have symptoms or if you're immunocompromised. And then lastly, I wanted to talk about Legionella that we've had 2 cases in Yakima County that during our investigation, the excellent work of our public health nurses investigating, asking the right questions, determined that these 2 individuals traveled to Walla Walla County or Walla Walla and stayed in a hotel there. That information was put into the database system that links with Washington State, and another individual from Tacoma, Pierce County, also was identified as having Legionella, who stayed in the same hotel. So we all worked together collectively. Department of Health went to that hotel, collected specimens, and I'm sorry, for Legionella, it's a bacteria that is found in environmental water, but if it's in the pipe systems or water tanks, it's aerosolized, and when you inhale that, if you are immunocompromised, you can become really sick with it and develop pneumonia. But they were able to determine that on the 3rd floor of this hotel, there was Legionella in the plumbing. And so that just shows the great investigative work and why we do what we do and ask the questions. So they are now remedying their issue down there, and hopefully that's the only cases we've had come out of it. So, and that's it for me, unless there's any questions.
Any questions or comments?
Melissa, the DNA analysis of the Shigella that you're seeing in Yakima County, is it the same as the one you're seeing in Seattle or?
That we're hoping to get some information from DOH. It's really kind of funny that counties are not allowed to share information for whatever reason, but state has all of it. So we use them to take all of the county, other than COVID we were allowed to share, but it's a data share agreement issue. But we're relying on DOH to take all of our data information and compare it with the other counties.
Everybody might remember 1976 was the original outbreak of
Philadelphia.
in Philadelphia, and I was going to medical school at the time in Philadelphia. So it was quite a thing. All those microbiologists were running around trying to do it. We did not have DNA diagnosis at that time. They found it by injecting samples of sputum into the peritoneal cavity of rabbits. And they were able to grow it there and identify the organism. Fortunately, it's susceptible to some easily procured antibiotics. It was quite interesting. That hotel where it happened is out of business.
It was the American Legion Conference, right?
Yeah.
Which is where it got its name, Legionella.
Legionnaires.
Okay, so Legionella was once the Legionnaire's disease.
Yes.
Yeah, okay, yeah.
Yeah,
Still-
it's the bacteria versus
Sure,
disease.
yeah,
Yeah.
okay. All right.
There's some people may remember there was an outbreak at Children's Hospital. And they figured that out was a blind pipe. So it used to be connected to something and it was quite long and capped off at the end. And the water in there didn't move around very much, but just enough. And so Legionella grew in that pipe. And just enough of it would get out and aerosolize in the shower and the water supply. And the kids got sick from being exposed to that. So this happens from time to time. And the tools we have now can figure it out really quick.
Any other comments or questions? That will move on to Andy Wilson.
Morning, the Yakima Health District is still in the incident command for the DTG response. They began soil remediation on July 5th, and so far there's been no concerns or hazards.
Well, any questions?
It never happens like that.
Okay, move on to environmental health, Sean McGee.
Thank you. Good morning, everyone. So a couple things I want to touch on. Some of you may have heard, there was some concerns over the Mabton Municipal Water System, which is a Group A community served by a Group A community well that is regulated by the State Department of Health. we've stayed in communication with the State Department of Health and also have been communicating with the water system management entity. So the individual or the company that manages operations of that system for the city of Mapleton. The issue of the rotten egg smell. Turns out that there was some potential stagnation. They have 2 large storage reservoirs and they believe that there was not enough flow to keep the water from, becoming stagnant and having some aquatic plant life to kind of growing and creating a musty smell. So the plan for that is to increase flow through the aeration treatment units and only utilize 1 storage reservoir to keep the flow of water through the system more active. And that should take care of that. We also ran or DOH had them run inorganic compound panel, which tests for a variety of different contaminants. That came back clean. Bacterial samples or coliform samples came back clean as well. So happy to report that the water is not contaminated. It is okay to drink, and we'll be continuing to monitor that with the help of Department of Health and City of Mapleton with any communications or answer any questions they might have. So as of right now, it appears that the complaints were heard and they did identify 1 minor issue, but there's no major concerns around human health and safety for that water. Another item to touch on is the East Sela area, which, as you all know, has the PFAS contamination happening. We were in a meeting and have to report that the U.S. Department of Army is planning on installing large point of entry filtration systems for the households that are going to be above the EPA limit for PFAS. I believe that is the new EPA limit that is going to be set, I believe at 4 parts per million for PFAS, PFOA.
Sorry,
Yeah.
million or trillion?
Trillion, sorry, trillion, yes. Thank you for correcting me there. And the reason for that is current testing technology, they really can only test down to about 4 parts per trillion. So that's the limiting factor. But this is a huge step in the right direction as people will be getting treatment community-wide there. However, we are going to be communicating with the Department of Health, Department of Army, and Ecology over concerns around the movement of that contamination plume, ongoing monitoring for drinking water source prior to treatment, and then looking at where we think we need to expand testing beyond the East Sela area and see if that plume is contained in that area or if it's traveling offsite somewhere. So a lot of work to come on that, but we are making progress. As for landfills, Andy touched on the DTT fire response, so that's making progress every day. We continue to work with DTG and the Caton limited purpose landfills through their permitting process for the denial of permit renewals. We're making progress in some respects for both those landfills. They continue through the process, and yeah, we're just continuing to work with them and be responsive and look at information that they're sending us so we can move towards potentially reissuing permits or renewing permits. That's my update for.
I've got a couple of questions or comments on maybe about 3 of those issues, actually. So with the PFAS, and Sean, you and I communicated about this earlier this week, but I received an email from someone living on the Terrace Heights about the fact that they had PFAS concerns and a test for. It's not the
Blair Road, correct?
Yeah, right. And it's not at the level we're seeing in the Sela area, but it's there. And so I know that you're looking into that.
Mhm.
With the Mapleton issue, I've got to compliment the YHD here. I had a call from the mayor of Mapleton a couple of weeks ago about this issue because they were getting complaints and she was snowing in her own house, and I called Andre and he reached out to Sean and Department of Health and really sprung into action right away. I just appreciate your diligence on really addressing that need for these citizens of Mapleton. And I guess the other thing I was gonna ask about DTG. So, do you have any feeling about what kind of progress they're making towards getting back to being able to be in compliance and be issued a permit? Any thoughts on that?
Yeah, I believe we're getting close. So one of the things that is required by state regulation for landfill is that they're in compliance with other permits and laws that are applicable to landfills. It's in the performance standards and our WACs. So one of the things they need is a clean air permit. And I know that they've, I got a brief update from the Clean Air Agency yesterday that they're making significant progress towards that. But still too early to tell on what kind of timeline it would be before they were able to issue that clean air permit to DTG. I believe at this point, that's really the main item left for them to come into compliance with before a permit can be renewed. All the other issues that we outlined in our notification to them. There were 4 main issues. They've resolved 2 of them. And they're very, very close to resolving the 3rd one in terms of their stormwater control features on site. And then the cleaner. And once those are handled, we should be able to remove it from it. So hopefully, I don't have a timeline on the clean air permit, so I can't give a date when we'll be able to do that. But the goal is once that permit's issued.
Okay, well, thank you.
Any other comments or questions? Hearing none, we'll move on to public health partnerships. Leanne, bravo.
Thank you. So I'll give one update in the interest of time, just a quick update. We've been working collaboratively with Melissa's team to just happily say that we did purchase the 2 Narcan vending machines and we did receive the 1,500 doses of Narcan. So we'll be piloting that out, both the machine and the partnership with different businesses over the next month to make sure that we get our process in order before we are able to distribute widely in the community. So the plan is to have a machine operating here at the Yakima Health District. Of course, we'll notify everyone. We'll let the community know once that's available and up and running. And we will be working with several McDonald's locations on our business partnership and piloting that out. The reason that we're wanting to do that is because there are quite a bit of questions that are coming up, logistics, training that's needed, different questions around risk and insurance for the businesses specifically. So we'll be making sure that we get all those things sorted out before we reach out to the broader community. We're also working on collecting quite a bit of data and making sure that all of our efforts are being focused in the areas where we're seeing the highest rates of not both fatal and non-fatal overdoses. So much more to report, but just letting you all know that it is being worked on.
And if I may just add, this is really unprecedented to do this work. There's other places in Eastern Washington that are considering it and moving forward, but we want to make certain that we benchmark it, work with James. We're again delivering Narcan to businesses so that they are prepared to deliver that to their clients, their patrons.
2 quick things. So one, if you haven't read the letter to the editor this morning, the Herald did a nice job of applauding the health district for their efforts with Narcan distribution. So you should definitely read it. And the second thing is, I know last month we discussed on the 2 vending machines about the ability for someone without a smartphone accessing that. That's still something you guys are looking into?
Yes,
Okay.
yes, that's being explored as well. Yeah, so I'm happy to that we had a guest that to continue conversations as well across the community about how to make sure that this resource is available to the entire community as well.
Follow-up question. So first of all, where's the second vending machine? And 2, how did you come to a decision of which businesses to deliver the Narcan to?
Yeah, so as I mentioned, it's only one business at this point in time. Moving forward, we are going to be again using the data to make sure that we can help prioritize areas. But honestly, we've actually received quite a few inquiries from businesses that are interested already. What we're hearing is that, of course, we know that there are lots of overdoses happening and lots of in specific areas. There's some areas where they're happening more than others, and people are concerned. They want to make sure that they're saving lives. And so it is something that we want to make sure that we can get out as soon as possible, but also making sure that it's a efficient way to get it out to the businesses. So at this point, as I mentioned, it was McDonald's that we'll be working with just to start. And over the next few weeks, we're going to be hoping to expand that out to other businesses as well.
There's one in our lobby, you walked by one this morning.
Yeah, I know.
Thank you. I forgot about the sheet.
I didn't see it, but I know you did mention health district as well.
Box.
Yes.
Oh, it's in the box. Okay, yeah, that's why I didn't recognize
It's a
it.
huge box.
I did see the box.
Yes, and one thing I did want to add to is that Melissa and Lily's team are working on not just the distribution, but the awareness and assessment and epidemiology. We want to make certain that we are placing these life-saving measures in places where they're having the most impact. We don't want to place it where it's not going to be used. And this term, what we refer to quickly as hotspotting, is something that is often lacking in rural communities. Is where are the needs, where are the initiatives, and how do we bring those two together? So that's part of what we're attempting to do here as well.
And I understand that McDonald's reached out to the health district.
Yes, yeah. They're again, piloting in 3 different locations, and again, over the next couple of weeks, we already have others that have reached out as well. We're eager to get the resource out into people's hands.
I think that it's not just for their patrons, but also for their staff. You know, and there was one restaurant in particular where the staff went into the restroom and got exposed to fentanyl. So educating their staff and being able to help them as well, protect them as well.
Yeah, if I may too, this issue isn't just about a life-saving measure. It's to prepare people for what can be a very emotionally draining event. It's a great deal of responsibility, and it's tough on folks. We're dealing with very real public health issues here, but really life-changing events in the valley. So we want people to be prepared for that as much as they can.
Part of what we're working on right now, several of our staff on Friday will be doing a training for fentanyl response, so to teach them how to recognize it, how to also protect themselves from exposure. So that'll be part of the training that we do with the businesses as well.
And so that's the intent, is to make sure that everyone who has access to those resources is comfortable actually utilizing them. So those are the different pieces that we'll be making sure that we address over the next few weeks with the different businesses, but we're piloting broadly.
And if I may also, the great pleasure that we have at the health district is that we're aligning things that often in government don't align. Community investment, community awareness, engagement, the support of our board, but also the funding that allows us to move nimbly on a very serious issue. So to be a community responsive agency and have the access to funds through Foundational Public Health Services to make a very large investment. 1,500 is a great deal. It's expensive. So this has been really wonderful for us because often government moves at the speed of government. We're not attempting to do that. We're trying to be a community responsive agency that sees a problem, works with partners, and catalyzes change quickly. That's our goal.
Any other comments or questions?
Andre, potentially businesses could get together and help sources for further activities. I would imagine that would be something they would be interested in.
Yes, I think you're right. One of the things is that we know that there are some businesses that can afford to buy those. We also anticipate the cost of Narcan to go down dramatically once it becomes over the counter, but right now it's cost prohibitive. It's a small amount of money to pay to save a life, but that's why we want to invest in these partnerships. This is about educating also businesses that have another mission entirely, which is to, to provide their service to their patrons. We're trying to make it easier for them. That's some of the issues that we're coming up with is people have an interest. They know they're concerned. They want to protect their staff and the people who come into their business. So this is again an engagement with the business community that we're really hoping will.
Anything else? All right, so thank you to all of the staff for your reports today. I appreciate that very much. That brings us to unfinished business. We apparently have no unfinished business. All right, thank you. And our new business item has been tabled. until Commissioner, McKinney can be here because of her, people she wanted to talk about, so. We have nothing else on the agenda. Except for adjournment, so I would entertain a motion to adjourn to our next regularly scheduled meeting on August 30th.
Motion.
Second.
So we have a motion and a second to adjourn until our next board of health meeting, August 30th. All in favor, say aye.
Aye.
Any opposed? All right, we are adjourned. Thank you very much.